am pleased to introduce today's speaker, Michal Goldstein. Michal Goldstein is a registered social worker working at Dynamic Health Clinic in Toronto, where she sees adults for individuals, couples, and group counseling. She is also the founder of Creating Connections, a play-based therapy practice in Toronto, where she works with children suffering from mental health and behavioral challenges. She has over a decade of experience working with caregivers to support them in improving their ability to cope with the challenges inherent in caring for a loved one. Michal has developed numerous workshops and support group programs utilizing knowledge of interpersonal neurobiology and mindfulness techniques to support individuals suffering from physical health, mental health, and parenting challenges. She is passionate about bringing evidence-based practice to the forefront of the clinical social work field. Michal knows both firsthand and from professional experience the challenges that come with caring for a loved one with a physical and mental health illness, and is grateful for the opportunity to bring more awareness, education, and support to this community. Thank you so much, Michal, for joining us today. I will pass it over to you.
Thank you, Cleo, so much. Today, as Cleo said, we're going to talk about how caregiving stress affects you, and why this is so important and why we felt it was necessary to have a webinar devoted to this. As caregivers, it's hard to understand some of the things that you're feeling and thinking, some of the things that are happening within your mind during this time. And I hope this webinar will shed some light on that for you. So if you recall last week, for any of you that were on, and for any of you that weren't, we do have recordings of the webinars, and so I encourage you to go back and watch. It will be very helpful to understanding this image. But our goal in this series is to support you in making the shift of putting yourself in the center of the circle, that red figure that you see in the middle, putting yourself there and being able to focus this time and the next few weeks on, how to enhance your well-being as a caregiver, thereby enabling you to give so much more to the people around you. And we do this through the webinars that we have every Tuesday, online group coaching sessions that we have, as you can see the times here on the screen, and as well as one-to-one phone counseling that we have available during these days and times. There's also online coaching groups and phone sessions available in French. Thursdays 7 to 8, Mondays 7:30 to 8:30, Thursdays 6 to 7, and Friday 4 to 5. Those won't be given by myself, but another colleague who is available to give those sessions in French. So as we said, today's is week 2, where we're focusing on how caregiving stress affects you. And this is to go along with the webinar topics, where in the coming weeks, we're going to talk more about specific emotions, such as sadness, guilt, anxiety, and anger, and then some tools to counteract some of those emotions that we feel as caregivers, such as mindfulness, being a self-compassionate caregiver, finding your caregiving strength, and devoting time for yourself and learning how to do that, even though your time is so limited. So the online group coaching sessions really focus on taking the topics that we speak about in the webinar each week and really exploring them further, looking more deeply into the topic and allowing everybody an opportunity to share with others, other caregivers, and receive support from them around the topics that we're discussing or any topic that's relevant for yourself as a caregiver that week. Within the one-to-one phone counseling sessions, we are going to focus more on individualized support. So if there's a specific challenge that you're finding yourself coming across, to bring to life some of the topics we talk about in the webinar series for yourself individually, and being able to come up with problem solving around specific issues that you're encountering as a caregiver. So we're going to talk this week about stress. And what is stress? How do we define this word? We have to, in order to understand how to address it, right? So stress is really a burden or a demand on our resources that often we don't feel like we can handle. Now, stress can come from a positive source, like, you're moving into a new house and it's really exciting, or, you're starting a new job or a new school program, or you might be getting married or entering a new, relationship, moving in with a loved one. So, those are more stressors that come from something that for you yields a positive outcome. But there isn't always a positive cause or effect of the stressors that we encounter. Sometimes they, come across and we experience them as distress of, something that is unpleasant to us or something that we don't want to be experiencing. Now, within the role of a caregiver, sometimes you've taken on this role by choice, right? But that doesn't mean that the demands at times won't be very stressful for you. And that doesn't mean that you won't experience stress from these things, from these demands, right? So, whether or not you came into this role of a caregiver by choice or by necessity, in any event, you can be experiencing significant amounts of stress throughout the process. Important to remember as well that stress can also come not just from events that are happening, but from the way that we talk to ourselves about these events. And that's something that we're going to focus on specifically later in this webinar. So in order to really understand stress, it's very helpful to understand the impact that it has on your body. What is happening biologically in your body as it presents itself. Now, I'm not a doctor. I don't have a medical degree, but I want to present to you with a more simplified understanding of what happens biologically when stressors come, and you'll see that these help us understand what we can do to counteract the impact of stress. And that's why it's so important and why I'm sharing it with you today. So to understand, you see an image here on the screen. There's a trigger, something that occurs in your life, a stressful occasion from any sense of the word. It can be a small but challenging interaction with your loved one. It could be a more major, emergency hospital stay. But in any event, the trigger activates a response within your mind to say, that tells your mind, just like a physical danger, just like a physical event in your life where you might be scared, right? That same biological response happens within your mind, emotionally charged, challenging trigger within your situation. So whether or not somebody is being chased by a predator, or, the example always given is, in the wild, one animal chasing another, that trigger the fear response, what we call the fear response system, the stress response system. And so whether it's a trigger like that, something physical, or a trigger within your emotional world, something that's upsetting to you, your mind reacts to these two things in the same way. And your brain has a reactive cycle to that, which then instigates within our body what's called the stress response. So from a biological, what's happening is that you have a part of your brain called the amygdala, and the amygdala decides that you're facing a threat. Again, like we said, whether it's physical or emotional threat, and it sends a signal through nerve impulses to another part of the brain called the hypothalamus, and the hypothalamus in turn activates the pituitary, and the pituitary gland activates the adrenal gland, and the adrenal gland releases stress hormones into your body. And this is a biological system that occurs when we are triggered by a stressor. There is a Dan Siegel, I don't know if any of you have heard of the hand model of the brain. So the hand model of the brain is just a simplified way to understand what's happening when, we have certain triggers or stressors in our life. All right, so I was about to explain the concept of the hand model of the brain. It's just a much more simplified way of understanding what's going on within your system when a stressor occurs. So imagine if you pick up your hands like this, and you imagine that here, the wrist represents like your brainstem, okay? And that's responsible for basic things like breathing and keeping your heart pumping. If you fold your thumb in like this, and sits in the middle, just like the amygdala in the brain. The amygdala is responsible, like we just said, for sensing danger and telling the brain and the body that there is a danger, okay? Your fingers like this, if you fold them down, that's the prefrontal cortex. That's the part of your brain that helps us manage emotions and make complex decisions, okay? So when fear, danger, intense emotion, triggers, like we called them before, when they overwhelm our amygdala, so when they overwhelm this part, it's consistently firing off, right? And what happens is, what, you know, maybe you've heard this in just, you know, spoken, somebody flips their lid, right? When somebody flips their lid. And what's happening there is this part gets so intense, the fear, the danger sensories get so intense that you flip your lid. And what happens then is that what's in control is your emotions. What's in control is your reactive brain, like you saw in that last slide, your reactive brain, and your stress response and your fear response. So I'm not sure if that made it more complicated or easier to understand, but it's just an important part of understanding what's happening within our system. This is a biological response that's happening, and it's not something that we're, you know, doing or is wrong with us when we're experiencing. It's something natural and, you know, a biological aspect of our body. And please, if anyone has specific questions about this, I'll do my best to answer them at the end. But I just wanted to give, you know, just a glimpse into understanding a little bit about what's happening within our bodies. And the reason this is important is to understand, you know, everything I've just talked about, the stress response system, that's what is one aspect of our autonomic nervous system. We have two gears. To simplify, again, there's the sympathetic and the parasympathetic gears of our body. The sympathetic is everything we've talked about until now. It's that fight or flight mode, if you've heard about that, the stress response mode that you can also call it. That's everything we just talked about. On the other end of the spectrum is the parasympathetic nervous system. And that is what controls our what's called the rest and digest system. So our calm, what we're feeling, what's activated when we're feeling calm, and what's activated when we're at rest, that's the parasympathetic nervous system, right? So we have the sympathetic, known as fight or flight, and the parasympathetic, known as rest and digest. So what's happening in our body when the sympathetic nervous system is at gear? The way it affects our bodies, as we said, our bodies think that we are running from danger, physical danger. And so if you imagine, what are the aspects of our body that need to be in high gear when we're running from a danger? Our pupils are dilated, you know, our salivation is reduced, which then affects obviously our digestive system. We have an increased heart rate, increased respiratory rate, because what's needed, we need to get blood and oxygen quickly to our muscles to run, right? We have, you know, muscle tension, as we said. You might sometimes get headaches because of all of the stress hormones sort of overwhelms your system. You might get stomach aches because, as we said, the salivation is decreased, and so your digestive system is decreased, and so whatever you've kind of eaten at that point might not be digesting properly. And glucose is released further into the bloodstream because you are needing more energy to run, right? And so it's hard to understand, you know, why we might be feeling some of these things when we're undergoing stress. But when we understand this biological system, it makes it clearer to understand, why might we be feeling headaches? Why might we be feeling stomach aches, right? The way the body reacts to a physical danger is the same way it reacts to an emotional stressor. So now you can imagine that if the body is functioning this way for an extended period of time, that it will have a significant emotional and psychological impact on you. That you might notice yourself being increasingly worried or anxious, or increasingly sad, or feeling overwhelmed, that you have trouble concentrating, or you find yourself more irritable or angry, right? Because your body is functioning in a survival mode. I need to get to where I need to get to now. And that's going to leave little room for introspection, little room for patience, little room for tasks that take a lot of concentration, because you are focused on survival. Your body is focused on survival in that mode. So it's completely normal to feel any or all of these things if you've been undergoing any ongoing stress for a long period of time, specifically, as you go through as a caregiver. And so what are some of the reactions to stress? Sorry, I see that some of these words got a bit cut off here, but what are some of our reactions to stress when stress is happening? How do people cope with stress, right? How do you cope with stress? Some people might call for help, get medical treatment, do breathing exercises, look for a place of safety. They might try to run away, avoid the problem or escape, or they might focus on problem solving or resting to be able to recuperate from whatever the stressor might be in their life. And this typically is helpful when we're talking about one event, right? An event that is stress provoking. You have a major project at work that you need to complete, and you're focusing all your energy and attention on it. And after it's finally over, after those 3 weeks are done, then you have time to rest or problem solve for the next time you have a big job, how you can make things easier for yourself, or you can just try to calm yourself by breathing exercises, plan for a way that you're going to get help the next time, right? So these are all reactions that are useful and helpful when we're talking about short-term stress. But the goal of all of them is really to see a resolution of your symptoms, right? The symptoms that you feel over stress that we talked about before, that inability to focus, feeling anxious, feeling worried, feeling sad. You're really trying to, let's resolve the symptoms that I'm experiencing right now from one stress or another. Let's recuperate from that, and let's come back into ourselves. But as we said before, the stress of caregiving, there are constant external triggers. There's triggers in relation to your time, your emotion, your finances, and your routines, right? So if you recall, any of you have seen the webinar last week, we talked about all the changes that happen to a person when they become a caregiver. Everything that happens in your life, everything that changes, everything that is challenged in a way when you become a caregiver. And all of these different situations are further triggers for your stress response system, right? So whether we're talking about, you wake up in the morning and your loved one is maybe a bit negative, that's a trigger to your system. Then they're, wanting, or perhaps not so kindly demanding something of your time, of your money, of your energy. And that's another stress to your system. And this goes on throughout the day in one way or another, whether it's a phone call to a healthcare provider that's a bit stressful, or, conversations with other family members about your loved one that's a bit stressful. And all of these things continuously are triggering your stress response system throughout the day. So now let's go back to this stress response process and think about what's occurring in our body if these triggers, like we said, are happening numerous times a day, right? So we have, like we just said, whether they're, take a situation where your loved one might be, refusing to eat, or maybe you're caring for a loved one who's elderly, and every time they eat, it's a bit stressful for you because they might be choking on their food, or refusing to eat, or complaining about the food, or having an angry outburst that you're even trying to feed them at all. And so here you have this constant trigger, this constant reaction in your mind, and this constant release of stress hormones. So these stress hormones start to affect our mind and our emotional world. And you might notice some changes in your emotional state because, like we said, the stress response activates the fight or flight response in our body. So some emotional ramifications of fight mode, or you might notice yourself starting to become more rigid, manipulative, obsessive. Your thinking might become inflexible. You might be more judgmental or intolerant. You might become cynical or hypervigilant. You could, again, part of this fight mode would be somebody that would develop an arrogant self-image, denial about their situation, a desperate need to be right? It's this fight. You're starting to fight because your body is in that gear. A frantic defense of your opinion, aggressive, dominating, easy to anger, restless, impatient. And now on the opposite end would be a flight response, right? Which also is a typical response to ongoing stressors, a typical response to this fight or flight mode being activated. And emotional flight impacts might be people trying to be over pleasing, right? Attaching yourself to another to gain your sense of self, right? And try to please another person, consistently trying to please them, unendlessly trying to please them to help give yourself feelings of strength. You might find yourself worrying or more anxious or nervous. You might start feeling helpless or hopeless with self-pity over your situation. You might feel overwhelmed by your emotions. Some of these that we spoke about last week, the guilt and the shame that come along with caregiving and some of the emotions that come along with caregiving, a lack of self-care. You might find yourself indecisive or indifferent, a sense of numbness or disconnection, constant distraction, an inability to focus overall, and maybe a self-absorption or mistrust. And so you can see there's so many different ways that this might play out within a person, whether it's taking on that fight gear or whether it's that flight gear. They're the same system that's happening within your body, but it's just each person based on their nature will internalize things a bit differently. And so these are some of the effects that happen to our behavior when our body goes into fight or flight mode. And I bring these to your attention because it's so important to understand that, these are natural responses to stress. It is natural to feel these things when your body is undergoing stress for a long time. And what it leads to ultimately is that a person might find themselves feeling very burnt out. And, I've heard from so many of the caregivers that I've spoken to that this is the point that they're at. They're just feeling so burnt out from their role as a caregiver. And what's happening inside of you is that your body is stuck in this fight or flight mode. It's stuck in this stress response mode. And that's what happens when our body is constantly triggered. It actually gets stuck in this mode. And we need to actively do things to address these triggers. We need to actively do things to address the stress response in order to return our body back to a more functional and better way of functioning, one that has a better balance of this sympathetic and parasympathetic nervous system. So when you're in this burnout stage, what happens is not just this behavioral aspect that we spoke about just now, but actually a physical impact on your body. Because as we spoke about earlier, there are certain things that are happening within your body's functioning that change, right? The pupils being dilated, the heart rate increasing, the digestive system slowing down. These things happen within your body when you're having ongoing stress, right? So imagine that your body is without a proper digestion for an extended period of time. That's going to lead you to feeling not well, right? To feeling not well because there's so much of a release of hormones and now you're getting headaches all the time. So I hope that makes sense a little bit of some of the things you might be experiencing as a caregiver, biologically, behaviorally, emotionally, right? And now let's talk about how to address these things. So to expand this diagram a bit, we want to look at, we have a trigger, then our brain reacts the way it does, releases the hormones like it does, it causes a stress response. And now we have to choose how to respond. How are we now going to respond to this stress response in our body? So one, very simple and very easy way to start activating this parasympathetic nervous system that as we said, counteracts the sympathetic nervous system is simple, deep breathing. I actually have an alarm on my phone that goes off once a day that says, take 4 deep breaths in and out. Any of you that have spoken to me individually might have heard that before, because we need reminders. And whether it's as a preventative, meaning, coming when not necessarily a stress has just occurred, or, so you're preventing your body from being stuck in this stress response, or as a response to a stress that are happening at that moment, taking deep breaths can really help to slow down your body. What you're doing when you're taking deep breaths is you're sending a message to your body that things are calm, things are okay. Because what happens when your system goes into this high gear stress response is your breathing is actually quickened, your heart rate is quickened, and your breathing is quickened. And so we're using our body to send the message to our mind. That's that mind-body connection. We're using our body to send the message to our mind that everything's okay. Everything's calm. You're okay, and everything's okay. And so even if things are not okay, right? Even if things are very stressful, even if you're still in that hospital or you're still in the interaction with your loved one that's stressful, you can send a different message to your mind in terms of what's going on. And that takes us to the other piece. The other power we have is our thoughts. We can actually use our mind to impact our body, to send the message to our body that everything's okay, right? So that mind-body connection is so important. We're using our breath to calm our mind, to send the message to our minds, everything's okay. Or we're using our mind by what you see here, the other option of checking the facts, questioning your thinking. Let's look at what's happening and let's look at whether or not it's an accurate or an exaggerated depiction of what's happening here. We want to learn that not all thoughts are true. Sometimes our mind tells us, you're in danger, this is really bad, when really it's not, right? Sometimes it is. I'm not taking away that piece. But let's consider that sometimes when we're in this ongoing stress response, we might get much more worried or afraid of the consequences of certain things than we actually need to be. And when we reel it back in and think about, like we spoke about last week as well, what is in our control and what isn't, when we reel that back in, we're able to question our thinking a bit and say, what's the evidence or the facts that prove or disprove what we're thinking? So that option that you see on the screen of question your thinking, that means let's look at what the evidence is that such a concern can happen, right? So let's say you're thinking to yourself, I'm so worried to leave my loved one alone because what if X, Y, or Z happens, right? And so you can look, what's the evidence or the facts in the case? What is the evidence or the facts that X, Y, or Z might happen if I leave my loved one alone? Last week, I left them alone and they were okay. The time before that, I left them alone and they were okay. Is it really in their best interest that I don't leave them alone at all? Is that actually in their best interest, right? So it's just this questioning of our automatic thoughts. These thoughts come into our minds automatically. We don't even sometimes have a minute to think about what we're thinking about. But this process of questioning our thoughts just puts a little kink in the whole system of thinking, maybe it isn't this way. And maybe there's another way to look at it. And that's really what we want to open up. Maybe there's another way to look at it. And we're going to talk about this, this side about questioning your thinking a bit more in the next 2 weeks when we look at, some of the emotions like anger and guilt and shame that come along with caregiving and some of the things that you can do to counteract some of those feelings and to question your thinking around those feelings. The other part that you see here is the true alarm coping plan. So that's when we see that a concern is accurate, like we see that there is an actual concern, And we want to create a plan around how am I going to cope with this eventuality? What am I going to do to prepare myself for it? And we're going to talk more about that as we move forward. So what's important to know is that these, what we were just talking about, these coping mechanisms that we're trying to introduce right now, using the breathing, using questioning of your thinking, using this alarm coping plan, there are so many ways that people cope with stress that are very damaging to them, right? Whether you're, in this ongoing stress situation of a caregiver, or just in regular day-to-day stressors that don't relate to your caregiving, it's important to keep in mind when to seek help for yourself within a situation, right? Whether the stressors come again from financial loss or disruptions to family life, or restricted social life, or poor self-care that that might be coming as a result of this new role that you've had to take on. Or if you notice after 10 years of caregiving that here are these things that I'm doing that are unhealthy for me. It gets to the point that some people will use drugs or alcohol to cope, or might have suicidal thoughts as a result of their challenges and their ongoing stress. Now, I want to just take a minute to discuss some of the signs of an anxiety disorder, and we're going to talk about depressive disorder as well, just to keep in mind that it's a natural process that occurs when you're undergoing so much stress and your body is under this stress response system, that some of your symptoms might develop, whether in yourself or in your loved one. And so this is important, whether we're talking about yourself or your loved one, to notice, because they as well, right? Like we spoke about last week, caregiving is it's a family situation. And so the whole family is really struggling. And so you might see these symptoms, maybe not in yourself, but you might see them in your loved one or other family members. And so when we call something a disorder, what essentially we're saying is that these are persistent symptoms that go on for a number of weeks. It's not, today I'm feeling really worried, or this week because things are more heightened, I'm feeling really worried. But this is something that extends for a period of time. And you don't necessarily have to have all of these signs, but, a number of them in a cluster signifies that this might be something that you would want to reach out to somebody for help around. So signs of an anxiety disorder would include persistent worrying, an inability to relax, feeling constantly restless, a difficulty concentrating. You find yourself catastrophizing situations. You have a really difficult time calming down. You might even find yourself getting to a point of panic at times. You have a persistent fear about things, and that your some physical discomforts that might go around this are that digestive, muscle pain, headache, or insomnia. Now, as you can see, many of these are very similar to what happens when somebody is undergoing in a situation of ongoing stress and in this stress response mode consistently, right? And so that's why it's important to differentiate these as that they're persistent. So even when the situation is no longer present, these symptoms are persisting after that point. And that's why we really want to differentiate the two at this point, right? To understand that there's worry and fear that can be as a result of ongoing stress and this stress response in your system. And there's worry and fear that comes from, a situation that might require further intervention for yourself or your loved one. And like we said, so there's also the signs of a depressive disorder, such as persistent sadness, feeling hopeless, a loss of interest and pleasure in things that you used to enjoy, constant fatigue, disturbed sleep or appetite. You have trouble falling asleep. You don't have an appetite for anything. You're feeling anxious or agitated consistently. You feel guilty and worthless, and you have thoughts of suicide. And of course, if you have the feeling, or you hear from your loved one that a feeling of wanting to harm themselves or others, it's always important to reach out for help immediately, because these are real things that can impact yourself or your loved one, and totally understandable given the situation that you're in. So what we want to do when we think about, the stress response system that's happening in our body, these triggers, your emotional reactive brain and the stress response, is that we want to think about what are ways that we can actively work to prevent negative outcomes, right? What are ways that we can actively instigate this parasympathetic nervous system process? And we'll talk more about this at greater length in the webinar on becoming a mindful caregiver. But just some tools right now is to be able to function at your best when you're undergoing constant stress. Your body needs to be in the best possible quality and be in the best possible state when you're living with ongoing stress. So you want to be engaging in things that are releasing the opposite type of hormones, these rest and digest hormones, these pleasure hormones. You want to be involved in activities that are having that opposite impact to sort of balance out a little bit what's happening inside your body. So, sleeping well is so important. And I know so many caregivers have a lot of trouble falling asleep, but even just being able to, get yourself into the mode of, getting into bed earlier, putting your phone away, and setting yourself at least up for success in that area, and just having the most rest possible for your body. Then, of course, adequate nutrition. So taking care of yourself physically and ensuring that you're eating properly, which is something that's often so neglected when we don't have time, and those little scraps of time that we have are devoted maybe to things outside of our caregiving role. But in order to ensure that we're preventing these pitfalls of the stress response system, we need to make sure that our body is in the best possible state, and providing it with adequate nutrition is one of the ways to do that. We have exercise as well, taking restorative breaks, just allowing yourself a few breaks, using that breathing during those breaks. Time outside in nature is proven to be very helpful in, sort of releasing positive and pleasure hormones in our system. Just think about things that you enjoy doing. Do you enjoy art? Do you enjoy taking walks? Do you enjoy certain exercise? Do you enjoy listening to music? Anything that is enjoyable for you is releasing pleasure hormones into your body. So the more that you're actively involved in those things, you're setting aside the time for those things, which we'll talk more about how to do that in the last webinar. But the more that you do that, you set aside the time to be able to ensure that you're protecting yourself preventatively from falling into a situation where your body is under significant stress without any rest from that, without any break from that. So I want to talk for a minute about this True Alarm coping plan. And I believe Clea would have emailed that out to you all, a sheet that looks like this for yourself to do for any challenge or any specific problem that you find yourself coming across right now. So we'll just give the example here of, what if my elderly mother will fall going to the bathroom, right? So what's a likely problem that you find yourself coming across consistently, right? Rather than having this problem linger in our minds as a stressor, we can develop a plan around it, right? It might sound simplistic, but when we're in stress mode, often our simple thinking, problem solving skills are not in full gear. And so to have these things set out for ourselves are very helpful. So I encourage you to use this sheet to really write down what are some of the things that are worrying you right now. That would be in the first column. What are some of the things that are worrying you right now? And so what we want to look at is, how do we prevent this event from happening if possible? And the second part is, what do we do if the situation actually happens? And that's that coping plan. How will we cope if it does happen? So let's go back to the situation. We can prevent as much as we can the situation of your elderly mother falling when she's going to the washroom by providing her with a walker. You can reach out to an OT for some ideas, right? You can have a call out button, right? You can install a call bell. These are all different things that you can do preventatively and proactively to ensure that you should have as much of a preventative as possible for the things that you're worried about, right? What can I do? You're just going to ask yourself the question, what is possible to do to provide any level of padding for this situation to not occur, right? And then we look at, well, how will I cope if this does happen? Let's take the worst case scenario. Let's take the scenario where she does fall and ask yourself, what could I do to support myself if this would happen? You know, okay, it might mean that I might need to, you know, she might need to be in the hospital because she's hurt herself. And now it will mean that I'll need to, you know, be making consistent hospital trips. And that will mean that I might need to take time off from work. So even just writing down for yourself, what are the things that I'm going to do to help myself cope if that happens? I'll reach out to a friend who I know, you know, their mother fell and that happened with them. I'll reach out to, you know, a support person for myself to cry on their shoulder about what's just happened. But setting out for yourself a coping plan, a way that you're going to cope with an eventuality in a healthy way, is a really important way to help relieve some of the fears that come around worrisome situations, right? So take a look at this, you know, coping plan that you have for yourself at home. And I really encourage you just to try to write it down. We are going to be discussing it further in the group session. So I encourage anybody that's interested to sign up for those sessions. And then, you know, we can bring forward within the group different examples and we can support each other in being able to come up with a coping plan for it. And so the goal here is to come up with a new way of coping, a new way of looking at our situation, and a new way of coping with some of the situations that we're being faced with on an ongoing basis, because that coping gives us the support to manage some of the stress that we're going through on an ongoing basis. And, you know, we're going to work on all of these mindsets throughout, or many of these mindsets throughout the process of the webinars. But I think the most important part at this point is just to sort of stretch our minds to understand that there are other ways to think about our situation, and there are other ways to cope with what is happening to us. And that our thoughts are so powerful. So our worries, this is too much for me, I'm going to get sick, I can't handle this. Our body doesn't know, as we said before, the difference between a real and a perceived threat. And so these negative thoughts can actually trigger a stress response. And so what we want to do to start is to start noticing these thoughts that we might be having. Write them down for yourself even. What are some of these thoughts that are consistently coming into my mind that might actually be triggering this stress response, right? Consistently for us without an external stressor, but internally, these thoughts that are going on in our minds are actually triggering a stress response in their own right. And so, you know, I encourage you all to sort of, as keeping in mind this trigger stress response that happens within our body, keep in mind that these thoughts we have actually can do the same thing. And so, you know, we might not be able to control our situation and change what's happening in our lives in terms of our loved one, but what we can do is control the way we think about these things. And so to start using some of the tools like questioning these thoughts, thinking in a more accurate way about the situation, or a more positive way about the situation, and also using this coping plan to try to address some of the worries that are real, are accurate, and allowing us to gain a better control over our thoughts. Because the language that we use and the stories that we tell ourselves about what's right and what's wrong, they really harm us the most. And so that's something that we can really start doing now, you know, aside from any changes in our situation, which, you know, we will talk about ways to help you cope better with the situation in so many different ways over the next few weeks. But where we can start is recognizing that our thoughts have a lot of power and that we have the ability to work on those and provide ourselves with more support through working on those.
Next week, we're going to be talking about how to manage guilt and sadness. So more tools to relate to specific emotions that come into play and how to respond to those emotions differently. Thank you all so much.
Thank you so much, Michal. You really provided some timely information. Caregiver stress and burnout are unfortunately really common, so understanding the signs and when to seek out support is really important. So thank you again for touching on this topic.